Okay, hi everyone. So you hopefully know by now that Counseling 521 is all about psychological tests and assessments, which by the way is one of my favorite aspects of working in this field. So in this course, we'll be learning all about various types of tests, including how they are used by mental health professionals and issues related to the reliability and validity of different tests. We'll also be looking at some other elements that make up a comprehensive mental health assessment, like clinical interviews, observations, and behavior ratings. So as a starting point, we should note that tests are a subset of assessments, or in our case, as mental health professionals, clinical assessments. So a mental health assessment really tells a story about who the client is. I really like them for this reason, because we really get to see a whole picture of this person, why they were referred to treatment, and their presenting need or areas of concern. Generally goes through the individual's history, including their medical and mental health history, as well as it can go into detail about early childhood development and family history and dynamic. So the goal of these assessments is generally to identify or rule out some sort of a need. Maybe it's a mental health diagnosis, which can then better help inform and guide our course of treatment. And an assessment ends with a clinical summary and recommendations. So to clarify the client's diagnoses, their needs, and our recommendations, we often employ various standardized tests as part of the assessment process. Now, these tests can also be used as standalone tools that are not part of a larger assessment. But in terms of what you can expect to be utilizing right away, either in your current apprenticeship sites or immediately post-grad when you enter your first job in the mental health field, you may find yourself utilizing clinical assessment tools the most often compared to other tests, but we're going to get into all of them. So when we talk about assessments and tests that are standardized, the term standardization is simply what separates formal tests from informal ones. So to be considered standardized, a test actually has to meet specific criteria. So for example, there must be a standard manner of giving instructions so that the uniformity can be maintained during the evaluation of the test taker or the client. And there must be uniformity of scoring. So the scores have to be all identified through the same process. And then the reliability and validity of the test must be established. And we'll get more into that in a little bit. But in general, we want to know that the test is going to produce similar results each time. If it were given to the same person over and over again, would it result in the same general findings each time? And then is the test or tool truly identifying what we're hoping it identifies? So if the purpose of the test is to determine a person's IQ, is it accurate? Is the result of that test an accurate take on that person's IQ? A lot of different types of standardized assessment tools, and they're available for use really depending on your goal or what you're seeking to accomplish with your client. Aptitude and ability tests help to identify what a person is capable of learning, whereas achievement tests really determine what was learned. Neuropsychological tests really involve assessing how one's brain functions, which indirectly yields information about the structure of the brain. So really looking at the relationship between the brain and its function and how that has an impact on a person's mental wellness. And this is particularly relevant when diagnosing specific learning disorders or ADHD or autism. And in terms of personality tests, I think we're all pretty familiar with personality tests, one of the most popular being the Myers-Briggs. But this list here is a general good breakdown of the different types of standardized assessment techniques that a mental health professional or psychologist may utilize for one reason or another. So with aptitude and ability tests, there are three main categories here. General intelligence tests like the Stanford-Binet or the Wechsler can be used to determine a person's IQ, which is particularly important if we're working with someone who may need some additional help in school, for example. The Kaufman Brief Intelligence Test is an example of a condensed intelligence test. So we refer to condensed or mini tests, so to speak, as screenings. And they're considered screenings because they are less in depth, but can still give you a quick general idea of what we're working with here. And then there are all kinds of aptitude tests that can be more specific based on a particular area of interest or of concern. Achievement tests, on the other hand, are standardized academic achievement tests, and these really measure previously learned knowledge in multiple or specific areas. So these are determining what a person already knows, and maybe it's what they recently learned based on something like a class, or just a general knowledge base. And generally, these tests measure knowledge in specific areas like reading and math, or a variety of those areas. And then the scores of achievement tests are generally based on age norms. So you're determining whether a person's current knowledge base is age appropriate, or advanced, or maybe behind other people of the same age. And then that gives us something to work from in terms of what this person might need or what their potential is, and so on. Psychological tests, as I was saying earlier, can really help clarify a person's needs as it relates to learning and memory or other aspects of brain function. The Kaufman, for example, is a short assessment tool that can be used as a measure of the cognitive functioning of adolescents and adults. And the Stroop test is actually pretty cool. And you may be familiar with this. You've probably at some point in maybe even in undergrad in psychology, witnessed at least pictures of a Stroop test in which the client or test taker looks at words that are displayed in different colors. And then they're asked to say the color of the word instead of what the word says. So, the word might be banana and it's in the color green, and you're supposed to say green instead of banana. And these are repeated over and over again, a variety of words in different colors. It's just one example, but this one in particular can be used to measure a person's mental fatigue or propensity toward mental fatigue, or whether a person is also able to adequately concentrate or rule out external stimuli. And so this kind of test can be used to support or clarify an ADHD diagnosis. So an ADHD is a really good example of a diagnosis or a presenting need or concern that really has a clear correlation between a person's brain functioning and then how that impacts their mental wellness. So when it comes to personality tests, everyone's pretty familiar with them: the NEO, the Big Five, the Myers-Briggs. And what's important to know is that there are kind of two different subsets of personality tests. There are the projective ones and the objective ones. So objective tests are when the client is responding to a structured set of questions or instructions that have a set of response options. So these are the tests that have yes, no questions, true, false. Maybe there's even a correct answer from the list of choices for each question, and so on. And so those are the ones that, like, if you've ever taken some sort of personality test online, a lot of those are more objective tests, right? So they prove the computer is able to just produce a quick answer for you based on the options that you selected. And for the record, you will not be supported by anyone in the field if you ever try to diagnose someone based on a BuzzFeed quiz. Just for the record, maybe don't do that. But those would be examples of objective tests, whereas projective tests are given in a more ambiguous context. So projective tests are given in a way where the answer isn't restricted or limited to, multiple choice options or a set of numbers or something like that. They're given in this more ambiguous context that then allows the test taker or the client to impose their own interpretation in answering. So I think one of the more common examples of that would be the Rorschach, which involves the client interpreting the paint blobs for the test giver. That would be an example of where, there isn't like a set of options for the person to choose from. Instead, it's really telling how the person interprets it just kind of on their own without any limitations. Fear and interest inventories, these can be used by a school counselor or a career counselor to help the client identify or clarify their educational or post-educational pursuits. And the vocational interest inventory is a really popular one. It can help identify for the test taker what kind of job they're more interested in or inclined to do, like maybe manual labor versus a desk job, something more communicative and person-centric versus something more independent and quiet like data entry. It can really help a person narrow down their job search or even get an idea of what direction they want to move their career into. And again, it may be really useful for a student prior to going into college. It may help them determine what to major in college or even what kind of college to go to. Clinical scales are tools that clinicians utilize to most often clarify a diagnosis or assign a diagnosis. The PSS, for example, is a tool that clinicians can use to determine whether a client is presenting with post-traumatic stress disorder. Now, the tool alone, and it's important to remember this about clinical scales, that the tools alone aren't going to automatically just say, yes, this person has PTSD or this person has generalized anxiety disorder. But the results of the test, in conjunction with other information that the counselor has gathered about the client, can then help to not only confirm or maybe rule out a diagnosis, but also if a diagnosis is founded, determine the severity of that diagnosis. So the PSS is a good example of this, where depending on how many symptoms and the severity of the symptoms the person identifies, and these are symptoms of PTSD taken directly from the DSM-5, but then also weighted in terms of severity and the kind of impact that those symptoms have on the person's quality of life. The resulting score can then be interpreted, can be used to interpret the level of severity that the person's PTSD is at, which can then really clarify, how distressing this is in the person's life, how severe it is versus maybe it's the scores are really mild, and maybe we're looking at the person not actually meeting diagnostic criteria necessarily for PTSD. Yet, of course, again, we still want to be aware of this person's trauma history and being mindful of that. But again, so clinical scales are really useful, and these are the tools that you will find yourself utilizing pretty quickly. Depending on your placement, of course, but if you're working in a mental health agency of any kind and you're being assigned to conduct a mental health assessment, if you're not automatically required to, you may very much have the opportunity to and embrace the opportunity to employ a clinical scale. These are really useful also for quick screenings, like at the doctor's office or something. A physician may implement a brief clinical scale to quickly identify whether a client has a propensity for depression or anxiety or substance use disorder, something like that, so that they can have an idea of what they're working with. Environmental assessments involve evaluating the situational and the environmental variables that influence behavior. So a simple example would be the classroom climate scale, which involves assessing what is working well and supporting learning and what might need to be adapted to meet a specific need. So you will see that school psychologists and occupational therapists often utilize this kind of assessment tool when developing a support plan for an individual, or when helping an organization become more accessible to people with diverse needs. Strengths-based assessments are exactly what they sound like. So they're assessments that identify a client's areas of strengths. This might be specific to a certain category of strengths, like a person's learning style, or it might encompass a broader variety of strengths that the counselor can then consider as a potential resource to utilize during the course of treatment. For example, I'm a big fan of resilience resiliency scales, because the results of these can then be easily shared with clients in a really understandable manner. And then that can be really used to instill hope and a sense of optimism or motivation about the client's treatment and their ability to experience improvement and progress. And again, can really help you identify the set of skills that may be useful in the context of treatment. And so something that a lot of providers are being asked to do now is incorporate the strengths into a client's assessment and clinical plan. So a lot of times you'll notice at agencies where you're producing some form of a mental health treatment plan, so a service plan or a treatment plan, you may be asked to identify not only the client's strengths, but then how these are going to be used or can be used to meet the identified needs. At the end of the day, there are a gazillion assessment tests available for use, but there's a huge variety. And when selecting a tool, there are a lot of things to take into consideration. So some of the things that we would always want to consider when selecting or utilizing a tool is, first of all, is this tool standardized and evidence-based? And then also considering whether you are adequately trained to administer and interpret the test and so on. I think a big area that comes up, ethically speaking, for new counselors when it comes to clinical assessments and assessment tools and tests is scope of practice. So we want to be mindful of our areas of expertise and training and utilize tests and tools that fit with that. And as new counselors, you don't have a very large scope of practice yet, and that's okay. And so in those instances, you would be wanting to implement these sorts of tools with supervision and guidance, right? Somebody who is more trained and comfortable with both utilizing the test and interpreting its scores to help you then use that information effectively. The more widely used tools like clinical scales can be found online really, really easily. You can literally go onto Google right now and type in anxietyscale.pdf, and you'll immediately get, I'm sure of it, some direct links to printable copies of the GAD-7. But there are also a lot of tests that can be found via psych journals, books on specific testing and assessments, and of course, some of the more comprehensive and detailed tests cost a lot of money compared to the more common tools that are so common that even though technically you're probably supposed to pay something for them, you can literally just print the PDF online. So if you're like me and not really a fan of math unless it feels actually useful, you will find that basic statistics are actually fairly understandable and useful in this field. There's just no getting around it. Now, if you're really resistant to statistics, like I was initially, you aren't really going to have to dig into a bunch of it. For the record, post-grad, unless you're conducting psych research or an IRB approved study or something like that, you're not going to have to dig into all of the statistics. But it is important that during this course, we do get to learn them and what these concepts mean, because even on a smaller scale, like as a mental health counselor, you will want to know how to not only use a test, but also how to score it and then interpret the scores. And frankly, most are really user-friendly and not very difficult to navigate, the tools, I mean. But tests and tools, they generally produce some kind of raw score. And alone, that score isn't very meaningful, right? It's just a number. It's just a general result that you got from this client. It becomes meaningful when you compare that score to a norm or some other method of interpretation, right? You're then able to glean some information from it. It allows you to compare the results to other tests and see how the person is in comparison to other people, in comparison to similar people, right? So again, looking at the severity of a diagnosis or looking at a person's level of intelligence for their age compared to other people of their same age. Some other really basic statistic concepts that are useful are the central tendencies. So we're all pretty familiar with measures of central tendency, whether or not you remember them being just that, measures of central tendency. But these are the mean, median, and mode, right? So mean is the average, median is the middle or central tendency, and then mode is the most frequent or common score or data point. And then there are the measures of variability. So the range, like the highest to lowest scores achieved on a test. So the highest scores that could be achieved on a test compared to the lowest scores, the distance between those is the range. The interquartile range is the best measure of variability for skewed distributions or data sets with outliers. And then standard deviation measures how dispersed the data is in relation to the mean. For now, you should remember that the interquartile range can be used to identify any outliers in scores. And the standard deviation can be used to determine how close or far away the scores are from the average. So again, the most simple example of that in terms of standard deviation would be, how close is this person's results on their IQ test? How similar is that to the average IQ, or far away from the average IQ?